Our journey begins with a significant breakthrough that emerged in the last decade, the advent of immunotherapy drugs. Pioneers such as Keytruda, Opdivo and Yervoy have shown immense promise. These drugs work not by directly targeting cancer cells, but by empowering the body's own immune system to launch an offensive. They act as checkpoint inhibitors, unmasking cancer cells that have been hiding from our immune defenses, thus enabling our bodies to wage war against the disease. The next chapter in our fight against cancer introduces an even more personalized approach: CAR T-cell therapy. This revolutionary treatment involves genetically engineering a patient's own T-cells to identify and attack their specific cancer. It's like giving your immune system a detailed map and a set of instructions to find and destroy the enemy. This therapy has shown particularly impressive results in the treatment of blood cancers such as leukemia and lymphoma. Our journey continues with the development of targeted therapies. These treatments act like heat-seeking missiles, homing in on specific genetic mutations or proteins found in cancer cells. Alecensa for ALK-positive lung cancer, Vitrakvi for NTRK fusion gene cancers, and Rozlytrek for ROS1 and NTRK lung cancers are just a few examples of how we're personalizing the fight against this relentless disease. Then we arrive at liquid biopsies. Imagine being able to detect cancer DNA through a simple blood test, guiding personalized treatment and monitoring disease progression without invasive tissue biopsies. That's the power and promise of liquid biopsies, and they're available right now. We're also standing on the precipice of a new era with mRNA vaccines. Currently undergoing clinical trials, these vaccines aim to prevent cancers like melanoma and lung cancer by activating the immune system against tumors. In the pursuit of prevention, new screening guidelines, such as those recently expanded by the USPSTF for lung cancer, are helping to detect cancers earlier in high-risk groups based on age and smoking history. To recap, the fight against cancer is multifaceted. We're harnessing the power of the immune system with immunotherapy drugs and CAR T-cell therapy. We're personalizing treatments with targeted therapies. And we're detecting cancer earlier and easier with liquid biopsies and updated screening guidelines. And we're on the cusp of a new frontier with mRNA vaccines. The battle is far from over, but as Churchill said, we will never give up. The journey continues, and the future holds great promise in our relentless pursuit against cancer.